I want to bring in the former chairman of the D.C. Democratic Party, Scott Bolden, Republican strategist Ford O'Connell, for their reaction to all of it. Ford, I'll start with you. You know, look, we were all hopeful, those of us who want, say, tax reform going through, hopeful that this might happen. It's not going to happen, at least not just yet. What do they need to do to salvage it?
Well, they need to obviously get 51 votes, Trish. Look, I didn't think that this was going to be done by July 4th, but I do think that the drop-dead deadline here is going to be August 1st because of the budget reconciliation process. Here's my problem with Senate Republicans. They have to recognize this is as good as their hand's going to get, and it is not just about, you know, making good on a promise. It's a moral imperative here. Premiums are skyrocketing. Medicaid needs to be stabilized. The individual needs to be stabilized. They, frankly, need to do their job. And you want to know what? Some of them might have to walk the electoral plank. But guess what, Trish? That's what they signed up for, to help the American people not prolong their Senate career. You know,
I want to remind the viewers, you're looking at a live picture there coming to us from Capitol Hill. We are waiting, everyone, on Mitch McConnell. Mitch McConnell, who many think is a magician, is not able to pull it off, at least not by July 4th. That's what we are hearing. So what will he say? What does he need to tell Americans right now in terms of how they move forward on this process? Because, Scott, they just can't seem to find the cohesion here that they need.
But it's not the cohesion, Trish. What it is it's a bad bill. You know what the definition of a bad bill is? You've got the hard right and the liberal left of the Republican Party. They both disagree. This isn't about health care. It's about a wealth transfer. It's about reducing taxes and the deficits. The hawks like that, but then you have the Susan Collins of the world and those who are up for re-election in middle-of-the-ground states that Clinton won, and they can't afford the Medicaid cuts. And remember, the American people were told by Donald Trump and other Republicans this new bill is not going to cut Medicaid, it's going to lower premiums, and it's going to cover everybody. Those are three promises that have been broken, and those are three promises that have been broken and have to be explained.
You know what it did do, which, you know, I think people could take heart in? It got rid of that employer mandate. And I'll tell you, it has been a real strangle, basically, a hold on small American business owners because, you know, basically they're telling you, Ford, don't bother getting any bigger. If you get any bigger, we're going to make you pay through the nose. And so it's this reverse kind of incentive where small, and I've talked to a lot of them, they say, look, I can't add that 50th employee. I just can't because the implications of it are too significant. And what I go back to is you want this economy to thrive. You want people to be employed. You want them to have these opportunities, and companies in turn will need to be more aggressive for their hiring. They will need to offer better benefits.
But to your point, Trish, this is as much a jobs bill as it is a health insurance bill, and we've seen this before. Basically, the employer mandate was killing the growth of small business and costing people jobs. You know, and what kills me is when a lot of hard right Republicans say, gee, this is Obamacare light. Two things I'd like to tell them. One, you need 60 votes to fully repeal Obamacare, and we have to actually work on what's in front of us. But this is not Obamacare light. To your point, Trish, it pulls back the employer mandate. It pulls off those taxes. It does not hold the gun to the average American to buy a failed government product. And by the way, if they don't get this done, they're going to have to cut a deal with Schumer and the Democrats. And we know that they have no interest in actually making this a free market good, but their interest is in actually bringing us closer to socialized medicine. And for the average viewer who may not know what that is, look at the VA. Do you want American health care to become just like the VA? Then hope that Republicans fail if that's what you want.
But Trish, here's the deal, too. Watch this. If the Republicans really wanted to make a difference and cared about health care, why not throw away the mandate? There are a lot of Democrats aren't crazy about the mandate. That's a big issue for the Republicans. Just get rid of it and cure that problem, as opposed to being obsessed with repealing the whole Obamacare piece, where you got these tax cuts. And I know there are arguments about why you need the tax cuts and the cut in Medicaid and what have you, but only 17% of Americans support this bill. In fact, Obamacare, because the Republicans are at civil war with one another, only 17% approve it. Actually, Obamacare's popularity is actually rising because of the discourse that the Republicans can't get their act together.
That might be taking it a little far,
question for Scott. What exactly constitutes repeal? Because as I just discussed, Scott, You can't fully repeal Obamacare without 60 votes. Getting rid of the mandate and getting rid of the taxes is exactly what we're going for, and yet you guys have shown no interest whatsoever.
Well, they're not going to, right? They're not going to, period. But let's be, hang on, Scott. Let's be realistic here. The Democrats do not want anything that would involve repealing Obamacare. This is President Obama's legacy. So when you start with talk of repealing Obamacare, well, that makes them very nervous. Obviously, the mere semantics, the mere words here are a problem for those on the left. So you want to fix it. Okay, so you but you just said that this program basically was a kind of fix-it for Obamacare. A lot of folks, well, forgive me if I'm putting words in your mouth, but that has been the complaint, right? A lot of conservatives say, well, this is Obamacare light, and the concern is that it basically just takes some bad parts of Obamacare and doesn't do enough to fundamentally fix things.